In this video, continuation of megaloblastic anemia. So in this video, we'll discuss clinical picture, laboratory diagnosis and treatment of megaloblastic anemia. So first, clinical pictures, anemia. Lethargy, fatigue is there. Okay, in anemia, lethargy, fatigue, weakness is there. Then clositis. What is clositis? The tongue become red and enlarge in size. The tongue become red and enlarge in size, so it is known as beefy red tongue. It is the picture of megaloblastic anemia. Beefy red tongue is the picture of megaloblastic anemia. Then vitamin deficiency only, not that folic acid deficiency. Okay, so the person having neurological that manifestation. So neurological manifestation that patient having because of vitamin B12. So how to identify that patient have that anemia, lethargy, fatigue, weakness, along with that tongue, beefy red tongue, along with tingling sensation. Okay, apart from tingling sensation, we collected blood sample from this patient. After that, we will do CPC. Report may clear megaloblastic anemia. These are the symptoms along with the blood samples. Along with the slide, we can confirm whether the patient having megaloblastic anemia or not. So, what are the other laboratory diagnosis, laboratory finding of megaloblastic anemia? Blood sample collection, bone marrow finding, biochemical finding, and special test for causes of specific deficiency of vitamin B12 and folic acid. So blood samples, what are the tests we want to do? HP, then RBC, then reticulocytes, indices, MCV, MCH and MCHC, then WBC and platelet. In the case of bone marrow, sampling biopsy, cellularitis, erythropoiesis and marrow iron we want to check. Then biochemical test, serum iron, serum ferritin, then total iron binding count, then transferrin saturation. Then special test, cycling test we want to do. This one main test for identification of vitamin B12 deficiency. Cycling test, vitamin deficiency, for that vitamin B12 deficiency, whether decreased intake or malabsorption or increased demand. By using cycling test we can confirm. So we will discuss one by one. First one is blood test. We know that HP fall. Okay, hemoglobin fall below that normal range. All the anemia that hemoglobin range fall. Then red cells. How we can identify? This one is the patient sample we collected. One drop of that sample placing on that slide. That tongue shaped smear we will prepare. Then by using Ramanowski or Jimsa staining observed under microscope. So RBC safe, size and color safe, whether it may be microcystic or normocystic, color hypochromic or normochromic, size also increase. Okay, normally 7.5 m, this one more than 7.5 m because it is the macrocytic. Okay, this one is the oval shape, so macro ovulocytes. So RBC characteristics, macro ovulocytes. Then here anisocytosis, that means various size of that cell. Then Phycocytosis means various safe. Then tear-shaped cell also we can find out. Then one more important thing, three important that evidence. What multiple dot is presented? Multiple dot is presented means that basophilic stifling. Then only one dot, single dot is presented in RBC means Cabot ring. Then inside 8, number 8 shaped is presented means Havel jolly bodies. So these are the three important evidence. Basophilic stifling, multiple dot, Cabot ring, single dot. Then Havel jolly bodies means number 8 inside presented. These are the special characteristic feature. So RBC different macrocytes, then based on the size, based on their color, then anisocytosis, poikilocytosis, then tear trap cells, basophilic stifling, Cabot ring, then Havel jolly bodies we can identify. Then reticulocytes count lower to normal in untreated cases. Then absolute value evaluated MCV, then evaluated MCH, and evaluate normal or reduced MCH. Evaluated MCV above 120 proponent to that severity of macrocytosis. This MCH above 50 picogram, then MCHC normal or reduced because hemoglobin content in the cell increased proponent to increase the size of RBC. Then leukocytes WBC, total WBC count may be reduced. Here hypersegmented neutrophil, normally it have the more than 5 nuclear bodies. Normally 2, 3, 4 lobe only presented, but here neutrophil having more than 5, 6, 7 lobe is presented. This one is the first manifestation of megaloblastic anemia. So more than 5 nuclear lobe presented in WBC. Inside WBC, hypersegmented neutrophil is presented. This one is the first manifestation of megaloblastic anemia. Then platelet, it may be moderately reduced. This one, that bizarre form of platelet may be seen. That means large platelet found. Then bone marrow finding. Marrow cellularity, there is increased erythroid hyperplasia, then decreased Me ratio. Cytoplasm are more abundant, so here bigger in size because of megaloblastic anemia. Hypercellularity, that erythroid hyperplasia increased myeloid erythroid ratio decreased. Marrow iron, Bruchian blue staining for iron in that marrow show an increase in number. In iron deficiency anemia decreased in number, here increase in number. Number and size of iron granules in that erythroid precursor. So here increase in size and number in Bruchian blue staining. Coming to biochemical finding, serum iron and ferritin may be normal or elevated. Rise in serum unconjugated bilirubin and LDH. So in this video, that clinical features of megaloblastic anemia, what are the symptoms, sign and symptoms, then What are the laboratory finding? In blood, HP level less, RBC less, reticulum low or normal, indices MCV decrease, MCH increase, MCHC normal, WBC and platelet level also decrease. Bone marrow cellularity increase, erythropoiesis increase, marrow iron normal. Then biochemistry, serum iron normal, serum ferritin level decrease, TIBC and transferrin saturation normal. Special test we will discuss in separate video. Then three important clinical features. What are the things? Basophilic stifling, then K-butt ring, then Havel jolly bodies. These are the important characteristic feature. Then MCV, MCH elevated, normal or reduced MCHC. Leukocytes count more than 5 nuclear low presented in WBC. Platelet count may be enlarged. That name is called as bizarre bodies, bizarre form. Then bone marrow, erythroid hyperplasia increased, ME ratio decrease. Sinkling test we will discuss in separate video. Thanks for watching.